Now we call upon the next speaker, Dr. Saranya, to present her topic on decrypting the mystery of bilateral unreactive pupils.
Good morning. My case report is on decrypting the mystery of bilateral unreactive pupils. A 14-year-old male came to our OPD with complaints of difficulty in seeing bright light for past 1 year. History of difficulty in reading was present. No history of redness or watering of eyes, headache, fever. No history of drug usage. No history of any systemic illness or autoimmune disorders. No history of ocular trauma or ocular surgery. On ophthalmic examination, his vision is 6.6 in right eye. In left eye, 6.12 with glasses improving to 6.6. Near vision was N8 on adding 0.5 D spare, N6 in both eyes. In anterior segment examination, right eye was normal except for the pupil. It was 5 mm not reacting to light and accommodation reflex was absent. Similarly, in left eye, pupil 5 mm not reacting to light and accommodation reflex was absent. Otherwise, anterior segment findings were normal in both eyes and extraocular movements were full in both eyes. Fundus examination was normal in both eyes. Color vision, contrast sensitivity and fields were normal in both eyes. Near point of accommodation was 14 mm and near point of convergence is 9 centimeter. On systemic examination, central nervous system and cardiovascular system were found to be normal. Deep tendon reflexes were elicited and was found to be normal. Blood pressure was normal. On digging into diagnosis, we did a denervation supersensitivity test with dilute pilocarpine 0.125% in a dim light room. Pupillary light reflex was recorded at baseline and at 30 minutes after instilling the drops. Before pilocarpine test, the pupil was 5 mm and not reacting. After pilocarpine test, the pupil was 3 mm and was reacting to light in both eyes. The post-drug effect was near vision was N8 after the drug installation it was N6 and near point of accommodation is 10 centimeter after the drug effect and near point of convergence was 7 centimeter. The diagnostic dilemma was light reflex direct and indirect were absent and on pilocarpine test was positive and near reflex was also absent. As a diagnosis of exclusion, we concluded as the patient patient was having AD tonic pupil because his accommodation reflex was absent. So Argyll-Robertson pupil was ruled out. There is no use of any drugs. So pharmacological mydriasis was ruled out. And on slit lamp examination, iris was found to be normal. So traumatic mydriasis was ruled out. And the patient had extraocular movements were full in both eyes. So third cranial nerve palsy was ruled out. And the patient was advised to do a detailed neurological workup and serological workup to rule out any associated diseases. MRI was found to be normal and neurological opinion and cardiologist opinion were obtained and was found to be normal. And serological examination does not show any abnormality and he was prescribed best glasses for near vision. AD tonic pupil is a disorder in which there is a parasympathetic denervation of the afflicted pupil resulting in poor light but better tonic near constriction seen mostly in unilateral in 80%.
Doctor, your time is up. Please wind up.
Thank you.
Yeah, please. No, you can wind up, I say. Go to your conclusion or your final one.
This is the flow chart showing the how we came to the conclusion with the anisocoria. We compared with dark and in a bright light room and we did a slit lamp examination and we could not find any iris sectoral iris palsy or anything and we did dilute pilocarpine examination with 0.1% and we found the larger pupil constricted suggesting supersensitivity which made the conclusion of AD tonic pupil as a diagnosis. These are my references.
Thank you. So this was post any viral infection or anything?
No, ma'am. No
Any-
history of any fever in the near past. There was no positive history.
You do get sometimes. Any cough, cold,
No, ma'am. In the past 6 months, he was asymptomatic.
Any travel to any region or something?
No, ma'am. He was a school student. He was going to school every day.
Any physician opinion was obtained?
Yeah, a neurologist, cardiologist, and physician opinion was obtained.
Because we have to rule out the autonomic dysfunction.
Yes, ma'am. It was ruled out.
Okay, thank you, doctor, for the